Tourism and Health is a new program that the Caribbean Public Health Agency created to respond to the health, safety and environmental threats that are impacting on tourism. The thing is, we are tourism dependent. And because we are tourism dependent, then obviously it makes sense to look at all the factors that are impacting on tourism for sustainable tourism. So from a health point, we at CARPHA do get reports of illnesses among our tourists, among our visitors. Some of them go back home and report to their countries. So we developed this program really to address these health issues, diarrhea, threat of Zika and so on, and the environmental issues like beach water quality and so on, so that we can make it better and we can have healthier and safer environment, healthier and safer food, better respond to illnesses if tourists do get it, so therefore we can improve our tourists' health as well as improve our local health.
The importance of standards in this entire equation, how does that work?
Yeah, sure. Just from the TDC perspective, and let me just locate where the Tourism and Health Program sits within the TDC. The TDC is charged with implementation of the marketing program for Trinidad and Tobago, as well for product development. And for product development, we look at it at two sides, soft and hard. And so soft deals with quality, standards, etc. And so the Tourism and Health Program for us is really a quality assurance program, really tasked to ensure that the visitor has a quality experience at the destination.
So how do you monitor though?
Well, we monitor different ways. So within the program, there is a M&E monitoring component. We look at, reportable illness. We look at measuring of things like beach water quality, looking at the level of food safety, the number of food safety outbreaks or the reduction of outbreaks, and general impact, increase or decrease in visitor arrivals and so on. So there are many different indices we use for monitoring.
Are there things that can be subjective? Because I can see someone saying, okay, when my belly hurt and I had diarrhea because the pepper that I'm used to is nowhere near the roasted scorpion that I had with this doubles that everybody telling me that I needed to have.
Yeah, well, this is the good thing about the program. It allows for standardization. So, we want to protect our people, we want to protect our hoteliers, we want to protect our vendors, and so on by having standards. So with this, if you do have a diarrhea, there is a standard definition. It's 3 or more loose stools. Not that I want to say that very early in the morning, in 24 hours. But then there are factors that really, that you do an investigation, which allows you to realize if it's related to food or water or something that you have consumed. And then there are other factors that allows you to really trace back to its source. So if it's a dumbbells vendor, let's hope it's not a dumbbells vendor, or if it's a hotel, or if it's something you picked up from another country, and by the time you get to Trinidad and Tobago, that time from you ate, which is called incubation time, to when you actually got the illness, it was actually
that's when it
manifested here. So that's a good thing. So there are standardizations. We have a novel system of where we can easily monitor illness by a web-based system. So, sometimes people don't like to report to, say, pick up a phone and call a health person. We have a new system. It's a web-based system called the THIS monitoring system, Tourism Health Information System, that allows you, just by scanning on your phone, you can just say, well, I've had diarrhea, I've had some issues, these are my gastro, and it will trigger investigation to allow someone to trace the source.
Let me just add as well, as we're on the topic of standards, it's also very process related. And so a huge component of this CARPHA IDP Tourism Health Program is a training program, which is geared towards making sure that persons within the industry with regards to food handling, etc., are well equipped with the knowledge and know-how. So for example, last 2 weeks, we had an advanced food safety training program that brought together a number of key stakeholders within the industry, as well as 15 officers from Ministry of Health. So it's as well as the hotel sector, etc. So it's making sure that all of the operators on the ground are tasked with the information with regards to critical control points, HACCP, etc.
How does this trickle down to the person on the street? Is it a matter of people policing and monitoring, they make sure that standards are kept? or is it a matter of training and building capacity with those actually people on the ground level?
It's actually both.
Yeah.
For us as well, we currently have a certification program that we want to pair with the tourism and health program. It's called the Trinidad and Tobago Tourism Industry Certification, where we actually contract the Trinidad and Tobago Bureau of Standards to do audits against national tourism standards. So we already have a system or framework in place, and so we can integrate the CARPHA IDB tourism and health standards into our current standards and certification program in order to get the results that we want.
And to add to that, you know, so it actually trickled down to, so besides the building of capacity, one of CARPHA's responsibilities is to provide technical guidance to countries to improve their surveillance system. So with this, we are not only building capacities, but really lending technical help to improve, you know, surveillance or monitoring of illnesses. So it does trickle down to let's say, the layman in terms of, having better access to water, safer food, better practices, better public health messages, and so on.
The Trinidad and Tobago is part of this. Who else in the Caribbean has jumped onto this bandwagon?
Okay, so, well, to back up, the CARPHA program is a regional program for all our countries. However, the IDB-funded project, which is under the program, is only for 6 countries. And we have a lot of questions about it, but we have to start somewhere, and funding is important. So everything we do will be extended to the rest of the region, but right now we are starting in 6 countries: Trinidad, Bahamas, Bermuda, Guyana, Belize, and Jamaica. Those are our countries.
I'm wondering, with this project in mind, seeing what it is you want to do, what is the best case scenario, and how much gap is there that exists so far?
So you mean that what are some of the gaps that is available right now? Well, as I said, we do have health, safety, and environmental threats. We don't have, whereas we in the Caribbean actually monitor illness about our locals, there is no system to monitor illness about our visitors who are coming in. So, I mean, for instance, the first likely case of Zika would have come in through a traveler. Not that traveling is not good. We want to promote traveling, but we want to know what's happening and be able to respond quickly. So there are food safety gaps. While we have a lot of training, we want to have advanced food training in how to investigate an outbreak, how to trace the source. So those are some of the gaps. So the project has 3 major components. One is designing this information system for early alert and response, building the capacity, and developing standards that can be used that are not only would be recognized in Trinidad and Tobago, but by all the regional and international agencies. So therefore, we have a global recognition. So it's all about building our tourism product and building our reputation, Caribbean as well as Trinidad and Tobago.
I think that aspect of being able to tell, okay, who is coming into our shores is what is very important, because Carnival, you know, Carnival, always, there's something coming in.
Yes.
So people are talking about vitamin C, even if you're not going out. But in terms of saying, you're able to have this website, you're able to say, well, this was the experience. Can you just give us what that URL or what that location is, please? Okay, so I don't know if our cameras can show it, but you can go onto our website right now. It's http://phis.carpha.org. So it's a simple system, but persons who enter the data, I want to let them know it's very restricted and very confidential. You don't have to write your names or anything, and if someone enters the data, that's all they can see. And what the system does, it has an inbuilt system of analysis. So a single case may just be a single case. Someone may come in here and, as you say, they react to our pepper, or they may just react after the change of environment. They're coming to a new country. So what we are looking for is trends based on epidemiological data and epidemiological trends over a period of time. So number of cases of diarrhea that has passed over a certain amount in a hotel or in an area, then there's an alert, and this then triggers a response. All right. Well, we want to thank you so much, ladies. No, give me that last point.
Yes, I just wanted to go back to the stakeholder aspect. This program is very stakeholder driven. In fact, it cannot be successful only if the authorities are involved, and the authorities being the tourism authorities, Ministry of Health, etc. It has to be on the ground. So the hoteliers, which is the first grouping that are a part of the pilot phase, they are so important because the visitors spend a lot of time at a property, and so they're going to notice signs and symptoms. And so it's important that the double vendor, the restaurateurs, the hoteliers, they really buy into this program because they are the driving force. Without their support, we won't have success.
Yeah. And by buying, one last word, we really want them to truthfully report, meaning that, you know, if someone is sick, they report. Not that we want to know their business, but really to report so we know what the trends are and what the issues are to deal with it.
Yeah, and I'll just wrap up with this. On a destination level, why this is so important, because the new traveler, the new tourist, they want value for money. They want, I mean, you and I, when we go to a destination, we don't go to get sick. We don't go to have a mosquito-borne illness, etc. And so with regards to value for money, with regards to that quality experience, with regards to destination attractiveness, it's important for us to address these issues.